I had to make a very difficult decision last night. I'm not going to be going back to the program, and this time I mean it. Back to the IOP program, and this time I absolutely mean it. Um, I was trying to figure out what to talk about today, and the phrases and words that came to mind were dark empath. Look that up, please, if you haven't already. Look up dark empath and dark empathy. When someone knows what you are going through, or they know what you're feeling, what you're experiencing, but they choose not to get into it. They choose not to care about it, or they use it against you. And spiritual attack, um, when you feel like your soul is draining, when you feel like you don't have a soul anymore, when you feel like you're dissociating or going somewhere and you're leaving the body behind, when you're wide awake and you're alive, when you're not dying and you're not falling asleep, you're dissociating, and that means you feel like you just can't be in the moment. You can't be there at a given time, and usually it's because it's too painful or too uncomfortable. And what I've been dealing with is, and I'll say it again, I deleted the videos and hid and deleted the videos where I talked about the IOP out of respect for them. I don't want to. My job here is not to put down the IOP or put down the staff there or the clients. But I had some pretty serious issues where I was dealing with limerence. I was dealing with some issues, and I own them. I do. I was dealing with some issues where I was being treated, or I thought I was being treated at worst passive aggressively, at best just blockheadedly, like they couldn't get into what I was feeling. But my instinct is telling me, if the people over there really cared about what I was going through, and if they really thought they could afford to take a little time and a little space and a little energy to get into what I was going through over there, the LGBTQ stuff, the limerence stuff, the issues resulting from it, I feel safe going back there, but I don't. And the mental health system, I'll talk about the mental health system. They give medication. They give you what the government insurance will pay for. They give you cognitive behavioral therapy. They might be starting to cover dialectical behavioral therapy. Is that right? DBT. They'll give you that if you have a cluster B thing or a really serious emotional thing where you've got to. They recognize you really need to learn to manage your emotions. They'll do that, but they will not. They will not get into your life experiences. They will not get into your life purpose, and their excuse for not getting into your life purpose is they don't want to talk about spirituality because they're supported by government insurance. They're supported by the business world, and that doesn't get into God or get into spirituality or otherwise. It gets into how much money can we make for X number of clients. They're into how they can treat the client most cost effectively and most inexpensively. And that doesn't leave a lot of room for imagination or color in the therapy process. If you want something like that, you have to go to a very expensive therapist. Even the Christian counselors they have to charge a lot of money too. They have to pay their rent. They have to support themselves too, and I understand that. So the mental health system is not into this intuitive stuff. Maybe the more private sector, again, you can have more of a choice of therapists, more of a choice maybe of even programs. In the public sector or the sector that treats financially challenged people or people that have Medicaid and or Medicare or other government benefits. forget it. They don't want to hear about the intuition. And again, I'm talking about my life experience. I'm talking about my experience in the mental health system as someone who's more spiritually oriented, more empathic, more intuitive. And, the mental health system will be mechanical. I'm calling it out. I'm calling out my experiences, and I'm probably not the only client who's going through it. I jumped back into the mental health system last year with my eyes open this time because I had my own mental wellness process, but it was really rough going through that. And then having a limerent experience with another client and doing my level best to get along with her and to be as respectful toward her as possible, as space giving, space holding as possible with her, and not consciously or actively telling her how I felt about her. There was no room or space for that. I didn't feel safe doing that. I didn't even feel safe talking about LGBTQ plus in group, and I did not name the person. I didn't even tell the other clients or talk in group about having a crush on anyone. I just said I'm having a hard time because I don't think this woman is, I don't think this woman really wants to be my friend. I think she even just feels sorry for me, or she's going through the motions because she feels like one of the counselors is telling her to. And I called that out last week in a note, and I thought she was very gracious about it. She hugged me, and I was surprised when instead of getting her lunch and putting it on the table and eating with me, she walked away. And after that, I never really connected with her again, and she didn't call me. So I don't know how she feels. I don't know what she thinks. And I tried to get support from the therapy. And I tried to tell them about my intuition saying it's over and I'm just really grieving a loss here. And they're telling me, Carol, just get over it, suck it up, let it be, let it go. Just let her do what she has to do. And okay, behaviorally I can do that, but I'm falling apart still over it. I'm really sad. And I don't feel supported. I don't feel like I can really share what I'm going through spiritually or what I'm going through emotionally, because it's a system. It's operated in a system. There are people with hearts there, but it's in a system. And my intuition tells me that one of the counselor that did arrange the date probably did tell this person how I felt about her. I don't know for sure, but it's like sharing that and sharing other things and sharing that I don't think she wants to be my friend anymore because I just feel it inside me, my very bones, my very soul. I feel it. And it's draining my soul, and I have to get over it. And that means I don't want to be around her ever again. I don't want to be around her ever again. And I think I need to leave now. They're telling me I'm being paranoid. They're telling me that I'm making it up and acting it up and making something out of something that isn't true. And I of course, meet them evenly, and I say, listen, it may be true, it may not be true, but I feel it, and if you can't honor how I'm feeling, and if I have to go in and day out and deal with her acting like I'm dead to her, that hurts too much right now, and it's counteracting my benefit here at the program. I have to dodge around her and come in to group 5 minutes late if I have to. And they're like, well, you need to be coming in on time. Well, that means I have to bump into her every day. That means I have to keep remembering every day that it was a failure. and I have to keep knowing every day that they're not going to be supportive. They're only going to call out symptoms and apply cognitive behavioral therapy to me almost as if it's a weapon against me instead of an alliance with me against mental illness. It's just really a bad show. So I've decided to leave the program, and I don't know if I want to get transferred to another program or not. I called my counselor's voicemail yesterday, and there was he didn't call me back today. So the driver called, but I told my roommate to go over to the window and go over to the window and say I wasn't coming in. And there hasn't been anything going on but after that. But I'm telling you, be advised if anyone's watching this video and they're getting frustrated and feeling unsupported because their intuitives are being ignored. It's because it's the mental health system. They're not into that. They're into giving you meds and being very analytical and logical and mechanical with symptoms. It might be useful in practical cases, like for example, if you want to learn how to go to the grocery store, or if you want to learn how to basically get along with people at a board and care or a group home, or if you want to learn how to ignore people when they're bullying you or whatever. It might serve a purpose. It might be practical, but in matters of heartbreak, especially in the within the clientele, in matters of feeling very feeling heartbroken, just feeling disappointed, very profoundly disappointed of a dying dream of something working out, at least a friendship, for God's sake. I don't want to sleep with her. I don't. Society would taunt me and say, yes, you do. You have feelings for her. That doesn't mean I want to act on them. And that doesn't mean that doesn't mean I'm going to. It just means that I can give that up. In fact, I'm not even physically capable of doing it. I have a condition that prevents me from even having relations with people. I'll share that. Sometimes you can't even do that. And I was willing to even give up the romantic stuff and just be her friend. But if she can't even handle that, or if she knows, or if the establishment there can't work with an intuitive or an empath, I have to leave. I have to maybe exit the mental health system again. But how am I going to keep my benefits? I was forced in there again last year so I could keep my SSDI, because they tell you have to be under the care of a psychiatrist to keep your benefits if you're being evaluated for a mental illness. And that's really unfair and really hard on a client when they can't even find an establishment or a provider that will work with them the way they need to be worked with. Even mental health clients or individuals, we have a right to be treated right. We have a right to be understood. We have a right to be seen, heard, and understood, just like anyone else does. I wish the government and the establishments that are providing our mental health care could understand that. Say, listen, maybe you don't want to spend money on that, but maybe you don't want to spend time on that, but everybody's different. If you want to accept LGBTQ people, if you want to follow and honor and follow those laws, especially here in the state of California, not to give aversion therapy, even covert aversion therapy. Knock it off. Don't discourage LGBTQ plus people from having their orientation. That's like telling someone not to be left-handed when they are. It really is. It's like telling someone to, buy brown contact lenses and don't have hide their blue eyes, for Christ's sakes. That's what it feels like. That's what it's like, man. You don't do that to someone, or you don't declare at the beginning of their admission, we support LGBTQs, and you know, we support these people when really it's, you know, you're operating under maybe a covert don't ask don't tell policy, and it's covert and unwritten and unspoken. And even if it's not about LGBTQ, they're handling me very badly, to a point where I'm being driven out again, just by ignoring my feelings, invalidating my feelings, and invalidating my experiences with this person, invalidating my feelings, and hurrying it along, and you know, and treating me like I need to just be done with it. It's very, very toxic, very unfair, very, very not right, very not okay. Why am I bringing this up? Because the mental health system does that. The mental health system may go through the motions of giving therapy and honoring individuals, but they don't. They really don't. They're still practicing covert invalidation and injustice, and they're still practicing very derogatory attitudes towards the mentally ill and LGBTQs. Cognitive behavioral therapy is not the only thing that works for us, and it does have its place. You know, I'd like to do cognitive behavioral therapy right now. Not all my problems are going to follow me out of there. You know, my counselor told me, if you leave, Carol, you'll still have your problems. Yeah, I will, but I won't have any more issues with her, because I'll never see her again. And if I, God forbid, feel another crush coming on anyone else, I'm going to stop it before it even starts. I'm not going to allow it to get away anymore. I'm not going to allow myself to be attached to anyone anymore unless I'm safe with them. And my intuition was telling me, screaming loudly in my ears, that I shouldn't get close to this person. She's dealing with some issues that are not safe for you. If this person is watching my video, I apologize, but they did affect me. Their behavior did affect me, and my feelings about them did affect me and did interfere with my process of treatment. And I hate problems, not people. I don't hate her. But I hate what happened. I hate the way she acted, and I hate the way I acted. And if it's going to interfere with my treatment, I don't want to go back there anymore. Trust yourself, ladies and gentlemen. Trust your feelings. Trust your intuition. Don't let the mental health system prevent you from it. Even if you're stuck there and you can't leave, it doesn't mean you're wrong. Not necessarily. It doesn't mean you're alone either. There are probably thousands of clients that have the same problem, that are going through the same thing as I am, as you are. It doesn't mean we're wrong. Take care. Please be safe. Call 988 if you're not. I promise I'll do the same if I'm not. I'm okay right now. I hope you are.